Hi, and welcome to this GBMC episode of What's Up, Dr. Dovec. I'm Dr. Dovec, and today I have the privilege of getting to have a undoubtedly fun conversation with Cathy Hamel. Cathy Hamel is a girl boss, okay? She is a leader, a highly respected leader, and she has been instrumental in the incredible state-of-the-art care that is being provided here with Gilchrist. So Cathy, thank you so much for coming on and sharing with us some of the insights of what you do for a living.
Thank you for having me. It's a privilege to be here with you.
Well, let's dive in. And I think a lot of people out there think that Gilchrist means hospice. But there's a lot more services than just hospice that you provide. Can you tell us, what does Gilchrist do and what do you love to accomplish for your patients and their families?
I'm so glad you asked that question. We have been working hard over the past 10 years to diversify the work of Gilchrist. In the state of Maryland, we rank 37th in our use of hospice care and 42nd in our length of stay, with one being the best. And so we recognize that it's hard for people to make decisions to move to hospice, and yet they need care. So we built a program called Elder Medical Care. Dr. Riley, who is our lead chief medical officer and a geriatrician by background, helped us to develop a home-based program for people in advance of hospice. These are people that have difficulty getting into a physician practice for care. It's hard for them to ambulate. It's difficult for them to find support because typically they're 75 years of age or older with multiple chronic illnesses. And so we take that care bedside. We involve pharmacists and social workers and nurse practitioners and physicians who essentially take a primary care office to the bedside at home. And we have found that that care has prevented unnecessary rehospitalizations. We have an opportunity to have lengthy conversations about how they'd like their care to go. We all have choices when we are diagnosed with an illness about how we choose to treat that. And we find that many of our family members and those who are under our care would prefer to stay home with their loved ones to receive as much care as possible rather than being in a facility, either a nursing home or a hospital.
I mean, Gilchrist, I just have always admired for really making that end-of-life care just such a special, beautiful moment. Do you have any personal stories that made you want to get into this? You seem like you have such a calling for this very unique specialty.
You know, I was had the good fortune of being raised by a mother and father who both worked in healthcare. My mother was a lab technician. My father was a pharmacologist. And, I had an event with my dad. He had a heart attack at the age of 35. And I, at the time, was having conversations with him about what death might mean to him. And I'm not sure why we had that conversation. I'm one of 5 in my family, but they were special moments for us. And my favorite course in school was about death and dying. And I just somehow, and I love older people. I think the wisdom that they bring and the stories that they tell about their lives have helped to enrich mine. And so I couldn't think of a better place to spend my time than in a hospice, and now a serious illness and hospice provider.
What does make this work so different, so unique from other aspects of healthcare?
You know, the hospice benefit is designed to require that physicians, nurses, social workers, chaplains, and hospice aides come together to provide a multidisciplinary experience for each one of our families. When you think about death and dying, you can certainly understand that there's a medical component. Most people would prefer not to suffer during the death process with any uncomfortable symptoms like pain or breathlessness. In addition to that, you worry about your family that you'll leave behind. your loved ones. And so there's a social work component associated with making sure that you have conversations and the ability to make sure that your family's going to be okay. For most of us, we aspire to some type of a higher power. And so there's a spiritual component. People wonder about what will happen next. Is there a next? Or does it end when you take your last breath? So there are spiritual issues that come up during the dying process. And then our hospice aides, of course, provide the daily care that people need and the assistance with bathing and ambulating and eating that sustain our life for as long as possible. So that team is required to come together at least every 14 days to have a conversation about what's going on with the patient and the family. And so we work in a very collaborative and multidisciplinary way.
Yeah, I completely agree. It's certainly comprehensive and, like you mentioned, multidisciplinary. It takes so many people to make that moment actually special and not to be feared, but it can be just such a beautiful, beautiful time. What would you suggest if a family did receive that devastating news that one of their loved ones has a terminal condition? How do they just get started with this whole team and get started with Gilchrist?
Well, we hope that through some of our outreach, that people, you actually make your first end of life decision when you get your driver's license. And I'm not sure that we as parents or as consumers really talk about that. When I got my driver's license, I wanted the little heart on it, and I didn't really appreciate that meant that I had become an organ donor. But that is a form of an end of life decision. And I often wonder if I had had an unfortunate event where my parents had to make a decision at my end of life, would they have respected that? We hope that people will have conversations about how they want to die very early in life. I also drive the Beltway every day, and my primary care physician, I'm otherwise very healthy, reminds me all the time that the Beltway is probably my biggest risk factor. So we just never know when life might take us in a direction where death is more imminent. So discussing what you want for end-of-life care, making sure that your loved ones know what those wishes are. There's nothing worse than having a family member in the ICU and wondering what they would have wanted and how they want their care to progress. So we would encourage people to have conversations. If that loved one has already put those decisions into either a MOLST form or an advanced care plan of some sort, or just verbally articulated it, it's important to have those conversations about what they want. And I don't think we do enough of it in our society.
I completely agree. I was going to say these conversations, boy, that's difficult to talk to someone you love so much that, oh my goodness, even though we all know it's inevitable, we will die one day. But that's tough to think about talking to my own mom or dad about that. It's obviously that you don't wish that, but those conversations need to happen. And how do you recommend, you talked about certain forms and those sorts of things. How do I get those things documented, or how do I make sure people know my wishes and our plans well before these things happen?
Well, in the health system, if you're here at GBMC in the hospital, you can ask for a document called 5 Wishes, which helps you to articulate that work. Attorneys do this work every day. You can go to websites under advanced care planning. There is a website called Speakeasy that will walk you through first, and this is probably in some ways more important than the document, but designating someone to speak on your behalf if you can't. It's called a healthcare decision maker, and making that known through the Speakeasy website will also update your information in CRISP, which then makes it available to every health provider in the state. Designating someone to speak for you is the first step.
Great tips, great tips. Now, when you have these plans and you have it documented and you have these great conversations, these difficult ones, albeit, and when you have these things documented and then something like COVID-19 happens, meaning that the way that we treat these terminal conditions, I'm not talking about COVID-19, but the way we have to protect ourselves, your staff, the patients, their families, is a little different. I heard a quote from someone at GBMC that holding hands with someone wearing a glove is certainly different, but it is something. How has the care that you give at Gilchrist changed in light of the precautions that we're taking to keep everyone safe?
Thank you for asking that. It has really changed the way we provide work. We provide our work, so we are wearing full PPE. So, today that means a visor and a mask and a surgical gown of sorts. We have had to limit access to visitors in our centers. And we do allow a visitor in at the end of life when death is imminent, and we are doing lots of video visits to try to keep communication going. Just recently, in the past week, we've opened that to 2 visitors, and we will continue to open until we get back to the point where we have unlimited access to those patients. In their homes, we are still visiting pretty routinely. We have noticed a significant decrease in the number of people who are fearful about us coming in to treat their loved one. And we're beginning to see the nursing homes allowing us in to do our work as well.
Fantastic. And I can only imagine how stressful this is, even for your staff. You know, they're used to being, there's that connection that your team and all of those different disciplines come together and help the patient. And now they're wearing, you said, gowns and masks and gloves and all these extra things. What things are you doing for your team and helping them fight this stress?
Yeah. Our bereavement staff are running sessions, our chaplains, meaning they're helping people to talk about the stress and the difficulty in not being able to connect in ways that we connected before. I met recently with the leader of our Howard County unit, and she was so distressed over the fact that visitors couldn't be present that we kind of worked with her to say, okay, let's do as many video visits as we can. And she shared with me yesterday that she was now inviting people in for our meetings where we review the patient care. And we're beginning to adjust to the new normal. Our chaplains are doing daily meditations just for people to have a moment to think about their own safety and to take a moment to think about the environment and reflect on how different it is. And yet, how grateful we are that we remain healthy and able to serve and able to move forward as a team.
I mean, it certainly is a new normal for all of us in healthcare. There are absolutely special considerations for the end of life and continue to make that as special as we can. And speaking of the new normal, you brought up some telemedicine, some virtual types of connections with patients. Do you feel that that is here to stay even beyond these social distancing type limitations? Or do you feel as though there's nothing that's going to replace that in-person bond?
You know, I think it depends upon how this pandemic progresses. You know, we seem to be in a what I would call a controlled yet scary state right now. But I think there are people who are talking about a second surge and what that might be like. I think we are going to continue to use telehealth because we can do it more often than physical visits. And so what we hope we're going to see is a combination of those physical visits as well as increased communication through telemedicine. We also have families, of course, that are not here in Baltimore and may be traveling to come see their loved one, and we can provide intermittent visits as they journey back to Baltimore. But the extent to which people aren't traveling, which is what's happening now, the technology has really been remarkable for those family members who are not in the state of Maryland and can't get here.
I think embracing our new virtual reality is going to hopefully help us to even thrive beyond here. And some of those things, the technology might just be something that we do want to incorporate into the long term that will survive this pandemic. Now, you've had a lot of changes. You've had to pivot and really just change the way you do things in light of COVID. Are there any new projects, anything on the horizon that you're doing with Gilchrist that you're going to be offering to our community?
So we opened very early on, the second week of April, the only dedicated COVID positive hospice unit in the state of Maryland. And we have a 10-bed facility here in Towson. And almost from the day we opened, we have had a number of patients in that building. We would contend, of course, without that service, that those people would have died in hospitals. And at least in the hospice unit, they can have a couple of visitors come to see them and be present with them when they're dying. We've also done a lot of work in the nursing homes, especially those where the number of cases has been high. Our palliative care teams are working bedside to have conversations about end-of-life care and how people would like their end-of-life journey to be. And so we are very proud of the fact that our team has really stepped forward and into this crisis rather than trying to avoid it.
Well, that is absolutely impressive. You know, I hear you over and over again just really applauding this team that you are obviously so proud of, is nurses and doctors and advanced practitioners and aides and chaplains. There's so many people that it takes. And you know, I have seen it firsthand. I get to take care of some of the patients that are employees of Gilchrist, and I'm always just impressed by what their specific thing is with your team. Do you feel that your team here is one of the reasons why Gilchrist is so amazing? Why you know you're impressive. Let's just get out of the way. You lead by example. You should be so proud of the work that you do, but you could be anywhere in this country. What made you take up here in Towson, Maryland? Why GBMC? Why Gilchrist? Why is this the place you want to do your life's work?
In the early part of my career, traveled across the country, doing different jobs in healthcare, and I adopted 2 children from Guatemala rather late in life, and wanted to be in a local community and part of a local community. I was fortunate at the time to be living in Maryland, and my predecessor, Catherine Boyne, was leaving Gilchrist, and we were having lunch one day. We also share dyslexic children. And so we were having a conversation about our kids and some of the challenges associated with that. And she said, would you consider applying for a job at Gilchrist? And I said, I would be honored to apply for a job at Gilchrist, and came and, of course, met the team at Gilchrist, and then had the privilege of meeting people from GBMC, the leaders at GBMC at the time, and was fortunate enough to be offered the position to serve in this capacity.
Wow.
And you're absolutely right. The team is amazing, and they inspire me every day. And the pandemic has been especially inspiring for me.
Well, I'll tell you, you've always been someone that has inspired me as a female. You are the epitome of what an excellent leader is, and it's evident by this incredible establishment that you have been pivotal in helping to create. And you should be absolutely congratulated for all that you do and all that you continue to do. You keep changing and revising yourselves and what you do to keep this excellent care going, and you should be so proud. So,
well, thank you very much.
Oh, you're so welcome.
It takes a team.
It sure does, and you've assembled an amazing one that we all just are in complete awe of the work that you guys do over at Gilchrist. So,
Thank you very much.
I'm sure, I mean, I learned so much about what you're doing. It's not just hospice. There's just so many other things that you're doing and offering for even your staff and for the patients and for the families. It's a lot. So, Kathy, how would you say is the best way for someone who maybe is on the cusp of making these very tough life decisions? How do they learn more, again, about what you just went over with Gilchrist?
So they can call us. That would be an option for them. They can reach us by calling 888-823-8880. We have care navigators staffed every day who take about 26,000 calls a year from people who are wondering about what to do next and know that they need help, but they're not necessarily sure what it is. And so we would invite you to call and meet us and see if there's something that we can do to help you.
Incredible stuff here. So, well, I want to say thank you again for your time today to educate all of us out there about the incredible work you're doing with Gilchrist. Please call Gilchrist and see if they have a service that could be helpful to you or to your family. And that is 888-823-8880. Kathy, thanks again for being here. You're just always a wealth of information. Thank you so much.
Thank you very much. I feel the same about you.
Thank you. So on behalf of this episode of GBMC's What's Up, Dr. Dovec, I hope that you learned something. I did. It's time to make those difficult decisions and those conversations, and they'll turn into something that can potentially be really amazing for you and for your family. So until next time, thank you for joining us. Goodbye.